So tell us first any revelations you have learned over the past weekend as to the spread of this virus.
Well, I think, as you said correctly, it's escalating. The number of cases that increase from one day to another is clearly going up in a very steep slope. It's well now over 17,000 cases, about 365 deaths. Some things that I think people should put into perspective. Although the number of cases right now is more than twice what we saw with SARS back in 2002, the death rate is clearly lower. It's about 2% and likely will get even lower as we recognize more infected individuals. At SARS back in 2002, the death rate was about 9.6%, between 9 and 10%. So it's still an evolving situation. We don't know exactly where it's going to go, what the pattern is, but clearly right now, at least the number of cases are accelerating.
The cases in the United States, Dr. Fauci, I mean, what I keep hearing and reading and what we all see is just how transmissible it is, how contagious this disease is. But if people actually traveled from Wuhan to the United States, why haven't we seen more cases in the U.S., those who are on the airplanes with these people, for instance, or in taxis or in Ubers?
Well, I think we have to be careful because it very well may be that the kind of casual contact that you would get on a plane or on a taxi or an Uber, as you said, certainly might be able to transmit it, but it isn't that efficient that just being near somebody. Very likely you would have to be in close contact for a period of time. The question that you asked, which is a critical question, is what about the people who've come to the United States? There have now been 11 cases in the United States, 2 of whom were infected while they were in the United States, and 9 of which actually came over with travel-related cases. The reason we haven't seen spread that is persistent type of sustained transmission is because of good public health measures. Those individuals, fortunately and appropriately, were identified, were isolated, and their contacts were traced, which is exactly what you like to see done. And that's the reason why thus far, and hopefully it stays this way, we're not seeing a lot of cases in the United States. And as the entry into the United States of potentially infected people is diminished because of the travel restrictions on both sides on getting out of China and of getting into the United States, excuse me, I think you're going to see a dampening down of that. And that's the reason why this was done, to protect Americans from travel-related cases.
Dr. Fauci, what about a continent like Africa, where the healthcare system is certainly not nearly as evolved at all as ours is? Is there a real danger there, in particular because there are so many Chinese nationals who actually work in Africa as well?
You know, I think you make a very good point. Whenever you have a healthcare system that is not capable, or at least not efficiently and effectively, to do the things that I just mentioned, identification, isolation, and contact tracing, the danger of there being spread in such an environment is much, much greater than if you're in a society that has a health system that allows you to do that identification and isolation.
You know what we've heard, Dr. Fauci, besides those, the death rate, what about those people that have contracted the virus? Are they testing negatively for them, the ones that have not died? Or are they recovering? Are they going home? I mean, how do you evaluate that? We haven't really heard about all the people who still have it.
Well, you're asking 2 separate questions, so let me see if I could answer them separately. If you look in China, of all of the people that have been brought to the attention of the healthcare system, about 25% of them have very serious disease and requiring relatively intensive or really intensive care. The vast majority of them are individuals who are infected and whose symptoms are relatively mild, that don't require the kind of intensive care. And then there are probably a lot more people who were infected in China who have not been really counted in the number of infected individuals because they were either asymptomatic or their symptoms were so light that they didn't come to the attention of health authorities. So although there are over 17,000 reported cases in China, the number is probably much larger.